Burning while urinating, frequency, or a sudden urge to pee? These could be signs of a UTI, a urinary tract infection among women, and it can affect different parts of the urinary system. In this video, we'll understand what causes UTIs, their symptoms, risk factors, diagnosis, treatment, prevention, and when a UTI can become serious. First, let's understand the urinary tract. It includes the kidneys, ureters, bladder, and urethra. What is a UTI? A UTI occurs when microorganisms, most commonly bacteria, enter and multiply within the urinary tract. Most uncomplicated UTIs are caused by bacteria from the gastrointestinal tract entering the urinary tract through urethra. The most common cause is Escherichia, commonly called E. coli. UTIs can affect the lower urinary tract, such as the bladder and urethra, or the upper urinary tract, particularly the kidneys. An infection limited mainly to the bladder is called cystitis, while infection involving the kidneys is called pyelonephritis. One classic symptom of a lower UTI is dysuria, which means pain or burning during urination. Another common symptom is urinary frequency. You may also experience urinary urgency, where you suddenly feel that you need to urinate immediately. Some people develop discomfort or pressure in the lower abdomen, particularly around the bladder area. Urine may sometimes appear cloudy or have an unusual smell, although these findings alone do not prove a UTI. Some patients may notice blood in the urine. This is called hematuria. Importantly, symptoms can vary. Some people may have several symptoms, while others may have only one or two. Lower UTI symptoms are different from those suggesting kidney involvement. A typical bladder infection causes burning, frequency, urgency, and discomfort.
A kidney infection requires prompt medical assessment. Untreated infection can become very serious.
Don't ignore symptoms like high fever or persistent side pain. Early treatment with a kidney infection can cause fever, chills, nausea, vomiting. It started with a fever, and now my back is throbbing. That pain is a sign the infection may have spread. UTIs are common in women. One reason is anatomical. The female urethra is relatively short. Bacteria reach the bladder more easily.
Using a urinary catheter is another important risk factor, particularly when the catheter remains in place for a prolonged period.
Diabetes can also increase susceptibility to certain infections, including UTIs. A previous history of UTIs is another risk factor for experiencing future episodes. So how does a UTI actually develop? In many cases, bacteria first enter through the urethra. The bacteria can multiply and travel upward into the bladder.
Normally, the urinary tract has several defenses. Regular urine flow helps flush microorganisms out of the urinary tract. Regular urine flow helps flush microorganisms out of the urinary tract. But when bacteria overcome these defenses, inflammation develops and symptoms can appear.
Doctors diagnose UTIs using symptoms, history, physical exams, and urine testing. A urine test looks for white or red blood cells, bacteria, or signs of A urine culture can identify the specific bacteria causing the infection and determine which antibiotic is likely to work. However, not every person with urinary symptoms needs exactly the same tests. When a bacterial diagnosed, antibiotics may be prescribed depending on the severity of infection. The choice of antibiotic depends on factor bacteria, local resistance. Now let's discuss practical ways to reduce the risk of UTIs. Drink enough fluids to maintain normal hydration, unless your doctor has advised you to restrict fluids. Avoid regularly holding urine for very long periods. Respond to your body's normal urge to urinate. Good personal hygiene can help reduce the transfer of bacteria. After sexual activity, urinating may help flush bacteria from the urethra for some people. Let's clear up a few common UTI myths. Myth 1. Every burning sensation during urination is a UTI. That's not necessarily true. Other conditions can also cause discomfort. Myth number 2. Drinking lots of water alone can cure every UTI. Hydration can help, but it does not replace appropriate treatment. When should you seek medical attention? Seek prompt evaluation if urinary symptoms are severe, persistent, or worsening. Fever and chills deserve particular attention because
Pain in the side or back, especially with fever, can suggest kidney involvement. Repeated vomiting, severe weakness, confusion, or feeling extremely unwell requires urgent medical assessment.
pregnant people with suspected UTIs should contact their healthcare professional promptly, because infections during pregnancy need careful evaluation. If this video helped you understand UTIs, share it with someone who might find it useful. Subscribe for more simple medical education videos. Remember, this video is for education only.